20 minutes past the hour now. Department of Health and Human Services cracking down on transgender treatments on America's kids. Top Trump administration health officials announcing these proposed actions.
So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice.
We as doctors have a duty to speak up, and that's why we're here, against this cruel practice.
There are thousands of kids that are in mental distress because they've been through this, families torn apart. We are going to fund science to help them.
Now, you heard there for that last individual is Dr. Jay Bhattacharya, NIHA director, and he's with me now. Sir, nice to have you on today, and thank you, sir, for coming on. Also at that press conference, there was a detransitioner, Chloe Cole, who said the following about this experience.
My doctors, rather than guiding me, they affirmed my childish misgivings about my developing body. At 13 years old, I was administered puberty blockers and testosterone in high doses. And when I was only 15, they removed my breasts. And this happened before I was even mature enough to understand that one day I would aspire to become a mother.
It's so powerful. What's the intent here? What will happen?
I mean, the intent here is to follow what the scientific evidence actually says, right? So what has been happening across the country is that parents are told by doctors that there is solid scientific evidence that if you don't allow the child to go through irreversible puberty blocking or other surgeries, that they're going to kill themselves. And in fact, there have been huge scientific reviews in the UK, in the Scandinavia, and now in the United States at HHS that demonstrates that scientific evidence is very, very weak. They're essentially doctors are telling parents a lie, that there's evidence that if you don't trans your kid, they're going to kill themselves. That's not based on science. Mm-hmm. So essentially, it's to follow the science. And to give advice to parents and to doctors and to the scientific community that we shouldn't be telling people that you have to do these irreversible things like puberty blockers in order to keep the kids healthy and happy. There's lots of different ways to address that than what we've been doing.
So what I've been reading here, it affects kids up to the age of 18, primarily. And also, if there's a facility that's doing this or encouraging it, they're going to lose some money because of it. Now, there are those who disagree, and I'll just read this statement from the president of the American Academy of Pediatrics, all right? She says, allowing the government to determine which patient groups deserve care sets a dangerous precedent. Children and families will bear the consequences. Well, how do you interpret that after we just heard from Chloe there?
I mean, the American Academy of Pediatrics pushed for closing schools during the pandemic. They pushed for COVID vaccines for kids as young as 6 months old, where there wasn't scientific evidence to warrant it. So it's just disappointing to see the AAP, which was once, I think, a good organization that represented the interests of children, essentially throwing away the interests of children in this and so many other aspects. Kids have been hurt. You heard Chloe Cole talk about what happened when she was 13 years old. The kids who have been through this, many of them, their futures as parents, to be parents, have been taken away. Moms or dads have been taken away from them long before they understood. The AAP should be representing the interests of children, not representing the interests of professionals who make a lot of money from these practices.
Let me squeeze in another one. Apparently, the president's strongly considering, is the phrase I have here, about reclassifying marijuana Schedule III, which would weaken the rules against it. There are about 24 Republicans who are against this. They write, reclassifying marijuana as a Schedule III drug will send the wrong message to America's children, enable drug cartels, and make our roads more dangerous. What does it mean, Schedule III? And what would you say to those who are against this?
Well, for Schedule III, it just makes, essentially it's for medical marijuana. It makes it easier for instance, someone who's a veteran who has PTSD to be prescribed the marijuana or marijuana-derived products mainly. So it's not actually making it easier or more available to kids, for instance. And already we have, I think, 20 million kids around, people around the country who are addicted to marijuana. Keeping a Schedule I hasn't protected them. What it will do, and this is really important, it will allow the NIH, the National Institute of Health, to study the matter. So including how do we address the addiction problems and other psychosis problems that sometimes happen with children or kids when they take it. And it'll also allow us to have sort of better research and science on using it for pain prevention for cancer patients. It's a complicated product. We need better science to do this, and the President signing this order essentially allows us to have better science.
Okay, Doctor, thank you. So for the best on that, hope you have a great holiday. Thanks for coming on today. Two very important topics affecting America's health.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.